Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. Thanks for tuning in this morning. My guest today is Dr. Don Burgess, a pediatrician at SMHC Pediatrics. Our topic today is Concussion Care. Welcome, Dr. Burgess.
Well, glad to be here.
We usually start off the show by finding out a little bit about the guest background. So can you tell us a little bit about how you got involved in medicine?
Well, years ago, I started out as a EMT on an ambulance service when I was at the University of Maine at Orono, and really liked the treatment aspect, and I actually was thinking about going into emergency services at one point, but then really got interested in development and kids, and the fact that over a span of 18 years you get all of this development that happens. It's one of the most dynamic periods of development. So that's what got me interested in pediatrics, and so I went to medical school and then did my internship and residency at the University of Pittsburgh.
And I've heard that you also have a background of working in Alaska. Is that true?
I did. I spent 2 years in the Kuskokwim Yukon Delta, which is kind of southwest Alaska. It's the western part of Alaska, which is pretty remote. So we had about 50 Alaskan villages that we covered, and there was a large number of pediatric patients there with a big variety of different things that I wouldn't normally see anywhere else.
Such as what kind of things would you see there?
Lots of chronic lung disease. We had a lot of alcoholism and a lot of kids affected by that, a lot of developmental issues, a lot of genetic syndromes that kind of showed up there in large numbers compared to the rest of the country.
Now here in Maine, are you seeing any trends in pediatric medicine that alarm you?
Well, I think, developmentally there's certainly a big surge in kids with developmental disabilities. So I think, we've had to change our practice from, referring a lot of kids out to being able to manage some of those kids. And one of the subjects we're going to talk about today, concussion, has been one of those big diseases that has actually led to developmental issues.
Now, we're here primarily to talk about concussion care, and that's a field that you work in. Tell us a little bit about what you see, the nature of the work you do for concussion care, and the ages of the children.
So we see a variety of ages that are actually showing up with concussions. I think years ago what happened was we didn't know a lot about a lot of these kids. The parents took care of them at home. They never sought medical care. And so what we're seeing is some of the consequences of multiple concussions throughout several years. Now, because we pay more attention to it, I think the numbers are going to go way up as far as the incidence of concussion. But it's more because we're recognizing it and we're actually taking care of it.
So let's talk a little bit about concussions. What exactly is a concussion, and what happens to the brain during a concussion?
A concussion is a type of traumatic brain injury that is caused by a blow or bump to the head. It's also caused by a jolt or the head just moving. So, for instance, a motor vehicle accident where you don't actually hit your head, but your head moves forward and then moves back when the accident happens. And it changes the way the brain works after that injury. The issue is more the motion of the brain within the skull. So you can see no outward signs of injury and still have a concussion. And you also don't have any findings that you'll see on a CT scan or an MRI of the brain. So it's something that's a clinical or medical diagnosis.
So what are the symptoms of a concussion? How do you know if you have one?
So a lot of times there's confusion right away. Definitely headache, dizziness, fatigue. Sometimes memory loss. The kids don't remember what happened before the injury, and they sometimes keep forgetting what's happened right after the injury. Those are two types of memory loss that we get concerned about. There's sleep issues, irritability. Some kids get a headache bad enough and an injury that causes vomiting, balance problems, sensitivity to light and sound, and a lot of the kids feel slowed down or very fatigued.
Now, obviously, children are very active. They're bouncing on trampolines and bouncing into each other and things that adults wouldn't do. Is a child's head designed to absorb those kinds of things? How does that work?
Yeah, I think what people thought years ago was that kids were better suited to take a concussion and probably recover from it. What we know now is that the injury sometimes affects development. So what happens is brains are developing from 0 right up through 21, 22 years of age. So if you get an injury during that time, your recovery may be pretty okay, but it may affect what happens developmentally later. So kids can look like they're recovering, and then after multiple hits and multiple injuries can actually have a lot of developmental issues that affect school, affect life in general.
So what are the primary types of injuries that you see in children? Is it children falling, hitting their heads? Are they involved in sports? What's the most common?
Yeah, it's a wide. I'm pretty amazed at the wide variety of different causes that we've seen. We've seen injuries from trampolines, from two kids colliding with each other. Certainly sports. Football used to be the one that everybody thought had the highest incidence of concussions. Now it looks like soccer and basketball are kind of starting to surpass football. And hockey has always been a major source of concussions. Motor vehicle accidents, obviously, we see a lot of concussions from them. Even if the kids are well belted or well restrained in the car, with the sudden stop, the concussion is caused by the head moving back and forth. And we've actually seen some concussions from airbags that are deployed as well, depending on the height of the child and kind of where the airbag is. So it's a wide variety of things. Skiing in Maine is a really big source of concussions. We see a lot of concussions related to falls or mostly collisions with other skiers.
So what are the best ways to protect your child? Obviously, more people wear helmets now. Is that making a difference?
I think the best prevention is education about the different types of collisions or injuries that can cause concussions. Helmets help a little bit. They really are there to prevent more serious injuries, bleeds in the brain, and skull fractures. The problem with a helmet is it doesn't protect you from the brain moving around within the skull, which is how a concussion occurs. So, but I do think some helmets do absorb some of the force that will make the brain move back and forth. So, for skiing, for the sports that really have a lot of collisions associated with them, there are also a lot of companies that are coming out with things that they tout as preventing concussion. But as we know right now, there really is no particular device that will prevent a concussion 100%. It may lessen the blow a little bit, like what a helmet would do. But some of these things have been put into the market, and some people wanted to mandate their use in things like soccer. But the studies really show they don't do much for preventing concussions if you take a really good hit.
Obviously, children have been active since the dawn of time. So why are we hearing more about childhood concussions? Are we just becoming more aware of it?
Well, I think what happened several years ago in 2008, a group of neurologists met in Zurich, Switzerland, and really sat down and said, what do we know about concussions? What do we know about concussions in the developing brain? And what types of treatment that are most helpful, and how do we assess that kids are ready to go back to their sport or to the activity? This international congress, I guess you could call it, came up with a set of guidelines that really looked at how do we get kids back to their regular activities? What do they need for treatment? And basically the treatment really kind of centers around brain rest. So you really have to rest your brain, just like if you sprained your ankle, you come off your ankle and use crutches. The same thing's true for the brain. You're almost kind of spraining your brain when you have a concussion. So really brain rest and kind of decreasing any sort of activities that you use the brain, which is a lot of different activities. And then what came out of this protocol was a series of state laws that really looked at, okay, we really need to make sure that kids are not going back to play right after a concussion, because that was happening prior to this these guidelines coming out. And then, what is it we need to ensure that kids are ready to go back to, say, a contact sport or to skiing, if that's where they sustain their concussion. So we now have developed a protocol, and there are actually state laws in place that mandate that kids do not go back to play. So if they're injured in a football game, they have to come out of that football game and then need to be medically cleared by a provider. So it used to be, we used to kind of give them a time frame. You can go back to football in 1 week. And we don't do that anymore. We actually see kids usually on a weekly basis after their concussion, really monitor what their symptoms are doing, modify their daily activities. We actually many times take them out of school for a few days and then gradually let them go back to school and let them start to do their workload that they need to do in school. This protocol also put into place a tool that we can use now called impact testing, which is a web-based neuropsychological test that can really tell us that the brain is working pretty okay before we put somebody back. So prior to this, we looked at symptoms, and when symptoms were better, we weren't really looking at whether kids were processing things the right way. So this impact test, which is now universally used in pretty much all the 50 states as far as I know, really tells us when kids are ready. When they get back to a baseline, which most kids are now getting when they enter high school, then we know they're ready to go back to play or go back to their activity.
So can you tell us a little bit about the impact test? What What's that like?
Well, it's a series of tests that basically are computer. It's on a computer screen, and again, like I said, it's web based. So actually, you can access anybody's impact test as long as you have their ID number. And basically, what it is the kids sit there, and it's either a series of words or some tasks that they need to do that really kind of tax them as far as memory and being able to process what's going on. So they have to follow directions and be quick enough with the response to to be able to show us that that they're processing things okay. A lot of times we measure a lot of different things: visual and verbal memory, reaction time, processing speed, those kind of things. And basically, what we found is there's some normals for ages, but not everybody can get to those normals. Everybody has different ways they process. So basically, what happens is as kids enter high school, they automatically get a baseline test. So that baseline test with no concussion that's around that period where they're tested is used to determine when they can go back to play. So the baseline is kind of used as the standard, and then as kids recover from their concussion, we start to match the numbers, and once the numbers are pretty close to the baseline, that's when we know they're ready to go back.
So if you're a parent and you're concerned that your child has had a concussion or has had a concussion in the past, what's the best thing to do?
So, this is a good talking point during well-child visits. We ask now specifically about past concussions. If we don't have a record of any, we make sure that we know about the past concussions because we do want to know if there's been an injury. A lot of times with repeated concussions, there are some complications that can happen, memory issues, focusing issues, sometimes mood issues with depression. I've seen several kids entering college that we didn't know they had multiple concussions during high school and just failed the first semester of college. And then when we started to look back, it was, I had a concussion that season during football, and I had a concussion in soccer, or I had a concussion in playing hockey. So I think it's very important to know because things that happen later on may have been affected by that concussion. So I think it's important that if somebody has a concussion, they let their primary care provider know that if somebody else has seen them. And certainly if you think your child has had a recent concussion, then the first point of contact should be the primary care provider to let them know that, there's been an injury, and to take the appropriate steps to make sure the kid's been pulled out of play, and to do the modifications if those are necessary.
No, you've touched upon the subject of depression. Is long-term depression a byproduct of concussion? Is that something that can be expected?
It's more associated probably with multiple concussions, but a major head injury, depression is one of the complications, especially more with a front hit or a back hit. The frontal lobe of the brain is really what takes care of emotion or controls emotion, as well as some other areas of the brain. But we find that a lot of kids that have a frontal kind of injury to their brain tend to have more issues with mood, anxiety, depression, sometimes mood disorders. But we do see a lot of depression that when we look back, there's been multiple concussions. Not all depression is from that. Some of it's related to genetics and other factors. But we're finding now that we're asking about concussions and some now tracking them a little better that a lot of these kids are going on to have depression. So yes, there's several studies that say depression, one of the causes of depression can be multiple head injuries.
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guest today is Dr. Don Burgess, a pediatrician at SMHC Pediatrics. We're talking about concussions, a topic of great interest to many parents out there. And we'll be right back after this message about SMHC's Walkin Care.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers Walkin Care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back here on Medically Speaking. We're talking with Dr. Don Burgess from SMHC Pediatrics. Let's go back and talk about sports for a minute, because I'm sure there are a lot of parents listening to this whose children play sports and they're concerned, should they let them? And what's the protocol if someone feels that a child has had a concussion during a sporting event? What's the protocol for that for the medical personnel?
So what happens now, and these folks have always been in place. There just wasn't a protocol in place for them to follow. But all the high schools in the state of Maine have athletic trainers. So what happens now in a varsity game or a game where there is a trainer right at the game, kids are evaluated right on the sidelines. So if there's a hit that's seen and the child looks dazed or the teen looks dazed, the athletic trainer actually has what's called a sideline assessment that they do. And if they really determine that, okay, this looks like a concussion, no questions asked, this child is pulled out of the game and sits for the rest of the game, even if they recover during the game. And the importance of that is that they need clearance afterwards. So it's not up to the athletic trainer to put them back in the game. And then what happens is that most children are evaluated by a medical provider. And there's a variety of medical providers now that can do this kind of treatment, managing concussions. All of us that have had specialty training in concussion management based on the new guidelines. So everybody gets it in their residency, gets it in their medical school, but more recently with the new protocol, everybody's gone back to school and kind of learned how to manage concussions. So you really want to be with a concussion-trained provider. And again, a variety of people have done this training: pediatricians, sports medicine, some orthopedic surgeons, definitely neurologists. And what happens is as the child's activity is increased, as the symptoms go down and as you do the impact testing to determine when they're ready to go back, there's a protocol that the athletic trainers will do to put them back to play. So with one concussion, we don't withhold kids from the rest of the season. Once we know they're recovered, we turn them over to an athletic trainer, and some physical therapists do this as well, where they do a return to play protocol. So it's a series of increasing levels of exercise that determine whether whether that child is ready to go back to exercise and then back to the contact sport. So what happens is the first day may be some light jogging, and then the athletic trainer assesses for any symptoms that pop up that have previously looked like they've been resolved. And then each day there's a progressive increase in the level of exercise to a level of exercise that's equal to the sport they're playing, and then some light contact, and then full contact. So that protocol takes roughly about a week's period of time, although there isn't a definite period of time that everybody has to go through it, because if you see symptoms at any time during this protocol, you pull the kid back and you don't allow them to play, and you start the protocol or kind of stall it at that level.
Now, if a child has had a concussion and the protocol isn't followed and it's undiagnosed, is there any way to undo any possible damage that happens, or is that window closed?
If a concussion is missed, I think what happens is that the kids chronically have symptoms. So the concern we have, there's two concerns about somebody returning to play too early. If it's within the same game or within a couple of days of the injury, there is a phenomenon called second impact syndrome, which is rare, but a potentially fatal kind of injury that happens because the brain hasn't recovered enough to be able to take another blow. So it's really two blows in rapid succession that could cause more serious complications like brain bleeding or something called a brain contusion, which is bruising of the brain. Those are separate injuries from a concussion. So the first thing is, more serious injuries that can happen. The issue about missing concussions is almost everybody recovers. So everybody's going to look fine in a week, 2 weeks. Sometimes it takes upwards of a month for kids to recover even from a mild concussion. What's going to happen later on if they take multiple hits that people don't know about, that becomes the high school senior or the college kid who's failing school, depressed, becomes suicidal, and then you're kind of backtracking and finding out that those were all related to injuries. So I think, everybody recovers, and if they don't take a hit right away, that recovery period isn't real obvious to people. So everything looks fine, but then they take 2 or 3 hits in a row, and nobody's been tracking the concussions, so they don't know that, that these injuries are occurring. We found that if you get a concussion within, say, a month of your first concussion, that injury may take less of a blow and have more symptoms, and those symptoms take longer to resolve with the second concussion if they're very close together. If you have one concussion 1 year when you're playing football and then you have another concussion the next year, those two injuries tend to be about the same. So the closer together your concussions are, the more serious the long-term complications can be.
Now, what is the youngest child you've seen with a concussion?
I just saw a 6-year-old, actually. So 5 and 6-year-olds we do see with concussions, all the way up through college age.
Now, as a pediatrician, what worries you most about treating a concussion and the parents' reaction to that treatment?
I think the reaction of parents to the new protocol, which has only been in place, the law's been in place since 2012, so we're only talking about 3 years, has been great. I mean, I think the parents appreciate the fact that somebody's going to really follow their kids and make sure that they're ready to go back. I've had maybe a few parents with kids that are in really competitive sports that really push to get their kids back. But the program they're in does not allow them to do that. So I think, we all have to work together. I have athletic trainers that will tell me, okay, I think you're putting this kid back too early, and I listen to them. So I do think the initial reaction to this has been really good. I think we're now seeing, on the average in our office, we see between 2 and 3 concussions a week. So there's a lot of kids coming in with concussions. It's ski season right now. We're seeing a lot of skiing concussions during football season. We see football concussions all throughout the year. We see motor vehicle accidents and other types of injuries. So I think we're better able to follow them, but we may be picking up some things that, much earlier than we did before. So that, going back to that example of a college kid who's failing and had 7 concussions, I think we're going to catch that kid a little earlier, because then we can send them for more formal testing if we feel like their concussions are causing long-term complications, get some modifications in school, treat some of their issues if we need to treat them.
Now, we often hear in the news about shaken baby syndrome happening with very young children, obviously. Is there any correlation between what you're talking about and that sort of syndrome?
There's probably a little correlation. Absolutely, there is a concussion that's involved with shaken baby syndrome. The problem with shaken baby is it's usually a lot more forceful than force than some of the kids get when they're in a sport. So there are further neurologic injuries that happen. There are shearing and breaking of nerves that happen. There's bleeding that occurs. True shaken baby syndrome has bleeding or interventricular hemorrhages that go along with it. So I think it's a much more serious injury, but some of the developmental issues we see after shaken baby are very similar to kids who have multiple concussions. So I don't think we see those with one mild concussion that is recovered the appropriate way. I think we see it with multiple concussions, and then babies who have had injury. That the infant brain is very vulnerable to trauma. So what happens in that case is that is a much more serious injury than you see in older kids.
Now, are children's brains set up so that they recover more easily? Is a very young child, are they able to recover more quickly, say, than an adult?
The recovery is much better the younger the child is. The issue is more, going back to multiple concussions that you just don't have enough time to recover between each concussion. But kids have something called brain plasticity. So if they get a really severe head injury with bleeding and motor deficits, cerebral palsy, something like that, they have a really good ability to recover and sometimes recover some of that function back, as opposed to adults who tend to, with stroke victims and stuff, they tend to only partially recover and they may not regain some of the motor ability or speech ability. So, I think the recovery for younger kids is probably a lot quicker. However, the more hits they take, the younger you are, the more likely you may get some developmental issues as well. So I think they're very vulnerable, but on the other hand, they tend to recover quite nicely, if it's just a single injury. So I think, we do see kids do make some pretty remarkable recovery after a real severe head injury that's more than just a concussion.
Do you have any examples of that, of children that you've treated?
Oh, I have a lot of, I would say I've got a lot of babies with shaken baby syndrome and a lot of kids that have had injuries when they were in kindergarten or first grade that I now see that are adult, either adults or older teenagers. You see some of them recover with some of their cognitive issues. Some of them are kind of stuck with, what happened after the injury. I tend to see a lot of kids with past major head injuries just because of my specialty where I do developmental pediatrics. So, I think with if those kids are followed closely, there's medications to treat some of the long-term symptoms. I think they do really well. So I have seen some pretty, remarkable recovery from a very complicated head injury in the past.
Now, if you have an older child, a child in high school, and there are medical trainers at the games that they're playing in, football games, etc. What about parents who have children in elementary and middle school? How can they be sure that they're to guard against concussions?
So middle school children don't have the benefit of having an athletic trainer at their sports events. And then there's the group of kids that do an individual sport like skiing or a league sport where there aren't athletic trainers readily available. Those kids, if they sustain a concussion, I mean, all the coaches in the state of Maine and across the country actually should be trained in some form of quick concussion management and know that they need to pull kids out of the game. If they're not pulled out of the game, then I think it's up to parents to initiate that and say, hey, I think my kid's had a head injury. I want them out of the game. And then what happens after that is that most people should contact their primary care provider. If there's a lot of serious symptoms, vomiting, severe headache, lots of confusion that doesn't resolve very quickly, then I would have children go to the emergency department to be evaluated because those kids may have a more serious injury. But if it's just some mild symptoms and the child's being pulled out of the game, I would contact your primary care provider. A lot of primary care providers can do concussion management, and they would start the process. There are several programs across the state that also do concussion management, so you can contact those. So the Maine Healthcare has a program for folks whose doctor doesn't do concussion management. And then I think the important thing is to make sure that middle school kids get baseline impact testing, and that's now becoming more available for middle school kids. For high school kids, the trainers do it as kids enter high school, but there's no one at the middle school level that's doing that. So I think getting a baseline test and calling folks to see if there's baseline testing available for that age group in middle school. Right now, the impact test is not researched enough to say that it's accurate below the age of 12, although there's a lot of studies going on now to look at another test or a modified test that may be suitable for younger kids. So I think you should contact your primary care provider, find out where's the best place to get management of the concussion, and then start asking your coaches and your middle school gym teachers where kids in the middle school can get baseline testing.
So if a parent, say, has a child who gets injured on a Friday night during a game, what should they do? Because reaction time obviously is very important.
It is. I think, again, if there's not more serious kinds of symptoms, severe headache, vomiting, confusion, then most folks can wait until the next day or even the next day on the weekend to contact a physician to have an evaluation done. If you have the benefit of an athletic trainer, they usually will determine whether you need immediate care versus, okay, you can follow up in a couple of days. But I do think, calling your child's doctor, and just discussing what might be the appropriate care is probably the best move on a Friday night.
So how can people find out more information about these subjects?
So the CDC has a great website. They've taken this on as a disease process. So if you go to www.cdc.gov/concussion, there's a lot of parent handouts. There's coach information. There's physician information. There's a sheet that we use called the acute concussion evaluation, where we've kind of create a score around how many symptoms a child has, and it talks about impact testing and what the importance of impact testing is. I'd say that's the best source of information for parents to go. It's a very easily readable site, so that it's not all medical jargon. It really has a lot of resources for parents.
And we've talked a lot about parents being aware of all this, but obviously sports coaches need to be aware of this as well, correct?
Yeah, and there is an initiative in Maine called the Maine Concussion Management Initiative that really has taken the job of educating all the coaches, all of the athletic trainers, and all the gym teachers, phys ed teachers in the state, and that's been in place for the last 2 to 3 years. So I think the word has gotten out there. There's a lot of education available for everybody that's involved with kids and youth sports.
Now, is there always a loss of consciousness with a concussion?
Actually, the vast majority of concussions in the milder end of severity do not have a loss of consciousness associated with it, which is why I think a lot of kids were returned to play thinking, well, they didn't get knocked out, so they should be okay to go back to their sport or to their activity. And that's where we've kind of intervened and said, listen, you don't need to have a loss of consciousness. It really is the symptoms afterwards and whether they're persistent. So we look at symptoms that are persistent more than 24 hours after the head injury.
So that old phrase, getting your bell rung, is really quite accurate.
Exactly. Stingers or getting your bell rung are actually considered concussions now and not a minor injury.
Well, we've run out of time for this week. My guest today has been Dr. Don Burgess, a pediatrician at SMHC Pediatrics. Dr. Burgess, thank you for sharing some important information about concussions and concussion care.
Well, thank you for having me.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities, brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.